Now we go to English. It's really a great honor and privilege to be here.
特别宽，而且特别广泛。然后我今天讲的一个是现代和将来的未来。
Relatively high relative to the history of magnetic resonance. And on the right is the latest, the fear of closed spaces. So and you can see a 1.5T patient coil and a 3T patient coil. A certain type of electrode, or else there's a lot of interference. And that type of electrode is called a dielectric electrode. You can see where the one on the bottom, which is the dielectric one, of the dielectric pad in this torso image, where a lot of the structures. There are several interesting approaches that we use for generating cardiac images. So that I'll just leave it that there are multiple different ways to shim. And when you have a system,
2D, 3D,
yeah,
volume.
Generally 3D shimming.
Okay.
Hard. This is the right ventricle and the left ventricle, and the right atrium and the left atrium. Oh, sorry. And it allows excellent quality images if the patients don't move and if they hold their breath. Previous approach called steady state free precession or fiat. Cardiovascular and magnetic.
做这个报告就是经常求这个未来。
It's important to point out that of all the imaging modalities, since 1952, the first two were given to Purcell.
他就讲说这个回顾一下历史。那么有6位科学家呢，因为扶正呢获得诺贝尔奖，因为4个科学家获得诺贝尔奖。
The third one, Fourier transformation to magnetic resonance, made major advances at Stony Brook Institute. Work to pioneer and instruments. One was a relatively narrow bore. Magnetic resonance is a larger technology, as you've seen, requiring a big magnet, infinitely more radiation, ionized radiation, than MRI. That one can see much of the difference in these two image sequences. Both in the two-chamber long axis and in this. There are multiple pulse sequences for doing many things. This one is fine metabolism in the heart muscle. And this is an approach that's been used much more. Does everyone have a sheet of paper and write a question? Any other questions? That was a good one.
有今天怎么摆呢？有空洞的表现。
But the just the focus for our micro separation.
So this study was focusing on.
Welcome, Professor Paul. 大家欢迎。
All three of these competing technologies, CMR, echo, ultrasound, and radionuclide. And the surgical approach that I mentioned that was like plastic surgery was very thin walls where there had been infarction of the left ventricle primarily, magnetic resonance LGE or DE is very important so that they are operating in RV volumes and systolic and diastolic and stroke volumes. We did visual interpretation at all. We used 4 methods of the distance between the centroid of the ventricle and the wall that it intersected. If you took all of these arrows and you made them with USD cardio, we use Marissa. And when the apex is removed, this part, it doesn't look that different, but the movements that we assessed in nuclear cardiology or echocardiography, it's white. 27.9. The end systolic volume index was 79. That was 28 to 33, significantly increased. So here's a comparison, much more interesting, between the pre-op and the post, that the end systolic volume index decreased. And let's go to the rest arm. And here is the follow-up at 2 years. And what we found is ejection fraction.
上午见面，所以呢，我们上午的活动就到这儿结束啊，大家可以回去休息一下。然后我们下午是按照这个日程2点20开始，好吧？
Very much. We haven't talked about perfusion, cardioangiography, and microvascular dysfunction. We alluded to the resting study, and with adenosine, perfusion imaging has been that that in the early days of magnetic resonance, line up.
这就是多平面这个，一会儿我回他下边要讲这个，应该是这部分是应该是灌注减低的。
Pattern and its distribution when one defines.
这是心肌里边的变化情况，然后在下边没有讲到下边，然后这些呢基本。
So here is the best intervention, well, maybe the most difficult intervention.
越高啊，它这个artifact这个回也越多，所以他讲这些。 另外一个呢，就是它这种分析软件，再一个就是这种。
Formats, which includes of course DICOM, JPEG, and plots that provide you with the severity of perfusion deficits as well as and you have a knowledge of this imaging procedure. Again, we would like to get delayed enhancement images.
事实上没报告都是。
I can't read it too well.
Refocus something now. I can't understand that, but it's right. That's just the Chinese girl, the American girl.
It doesn't matter for you and us can print the report, or you can look at the images. That's not me either. Okay, the name has been a lot easier to read them, especially for me. And this shows red, which is not good. The apex, variety of information is located here. Conversion, recovery, steady state reprocession, the ability to do blood flow using phase, interesting information, and also connects to other websites.